Hi, how's it going?
Good. How are you doing today? We got all of our recording stuff figured out, so we're good to go.
Finally.
Yes.
All right. Okay. Hi, how's it going?
Good. How are you doing today? We got all of our recording stuff figured out, so we're good to go.
Finally.
Yes.
All right. I am here with Dr. Alex today to discuss orthodontic treatment and your treatment after or towards the end of your orthodontic journey and what your smile transformation entails and how to keep that great smile at the end of treatment. But first, I'd like you to introduce yourself. We know you're Dr. Alex Mellion, but can you tell us who you are and maybe a little bit about Mellion Orthodontics?
I'm Alex Mellion. I'm an orthodontist, practiced in the Fairlawn Medina area in Northeast Ohio. Went to dental school up at Case Western Reserve in Cleveland, and then did orthodontic training at St. Louis University. We're a family orthodontic practice, and as an orthodontist, typically we will do treatments such as braces, Invisalign, expanders, and those types of things that are needed to kind of straighten teeth or improve function, as well as aesthetics for a patient.
Cool. So tell us something that you didn't just tell us about yourself, something fun, maybe a random fun fact or favorite hobby.
Yeah, no, I'm a girl dad. So I have 3 young daughters at home, a soon to be second grader, kindergartner, and then one still in pre-K. So my life's kind of just consumed with girl stuff at the moment.
Wild.
Yes.
All wild
Yeah.
Children. Yes. All right. Well, thank you for sharing that. So now we can dive into orthodontics, which is why we're here. So I'm going to ask you some of the common questions we get that come up during our new patient exams. So usually it's the first visit a patient and their family have with us. And for some patients, it's their very first exposure to orthodontics in general. They've never been to an orthodontic office. None of their family members have ever had treatment. And so it's all brand new. Can you tell me what makes a visit to Mellion Orthodontics different than going to your general dentist?
Yeah, we want the visit to be comfortable and fun for patients. We want it to be to see that we're a family, and that we treat everybody as family as they come in. So what to expect in that first visit? Typically, you'll be with us about an hour. You'll have a tour of the office. You'll meet a number of the team members, as well as we will take comprehensive records, which means a 3D scan of your teeth. We'll take photos. We'll also take some digital imaging so that we can have a full picture and assessment of what your options for treatment will be. After that's completed, you'll have a consultation with either myself or Dr. Zach, and we'll review all of your treatment options, whether it be traditional braces, Invisalign, or if it's just a time that we're going to watch as you grow and placing what we call our observation program. So not everybody that comes in may need orthodontic treatment at that time. And that allows us to kind of assess when the best time for as a patient, or if we can do some intervention treatment, if sometimes baby teeth need to be removed a little bit early to help guide adult teeth in or create some space for treatment that's going to happen later on.
Okay, so that's a lot of information there. So what I want to kind of go back to is that we do see a lot of younger patients. One of the questions we get during a new patient phone call is this going to hurt? Because kids are so used to going to the general dentist. Can you tell us how the general dentist and a first visit to Mellion Orthodontics is different, and does it hurt?
Yeah, so nothing hurts. All we're typically doing is taking photos of the teeth, whether it be with just a traditional camera that you may see a photographer use. We'll use that at times. We'll also use a special, we call it an iTero scanner, that basically just takes a bunch of quick videos of your teeth. So nothing hurts. There's nothing sharp, nothing pokey. Like I said, we want it to be a comfortable visit.
Yeah. So that iTero scanner is basically like a giant toothbrush.
Correct. Yeah. So it's basically just going over the teeth. Scan typically takes about a minute or two at most. And then you can rest throughout as we're doing that, but it gives a really comprehensive picture of exactly how your teeth are, how your everything is functioning as the teeth come together. And then it also allows us to kind of plan any treatment off of that, whether it be Invisalign or using that as what we call like records to plan braces treatment.
Okay. And with that scan, that 3D image that you take, what else can you do with that? Can you show me what I'm going to look like when I'm done with my
Absolutely.
treatment?
So there's a simulation program built into that, and it's something that we can customize kind of right with you in front of you. So if we're talking about a certain tooth or maybe how much of your front teeth show a smile, that allows us to really give you a good idea of what options would be from a treatment standpoint. And sometimes we look at different treatment options from if we're just addressing the front teeth or if we're looking at bite correction as well.
Okay. So we talked a little bit about kids and what they can expect during that first visit, but we have a lot of adult patients. And I think one of the most common questions I get when I take a call for a new patient is, I'm an adult. Do adults really get braces? Do adults really go through orthodontic treatment?
It's probably close to maybe 40% of the patients that we see are adults. So we do get asked that all the time, but it is definitely something that I know sometimes an adult might not know what their options are. We have patients they're currently in treatment in their 80s. So you're never too old for orthodontic treatment. And there's a whole variety of reasons that you may see orthodontic treatment, not just aesthetics, but function. If you may be having some jaw issues, or if you're looking to have some dental cosmetic work done, we may do orthodontic treatment before that to make it either last longer or have better aesthetics and function after that.
Okay, so that's great. You set me up for my next question, which was, do you think that everyone who comes in for a new patient exam, comes into our office, meets our team, do you think every single person needs orthodontic treatment?
No, absolutely not. There's definitely patients that can benefit from it, but there's patients that come in that if they have a great bite and their teeth are functioning well, and aesthetically things are in a good position, and they just may not need orthodontic treatment. Everybody that comes in doesn't need orthodontic treatment. And we'll be flat out kind of honest with you and tell you what the benefits are, if it's just purely aesthetic or if there's a functional component to it that you can definitely benefit from.
Okay, so along that same vein is that many of our adult patients say, oh, I have this one tooth. Can you fix this one tooth? Or just leave everything else alone. Can you just move this a little bit? Or it was never like this when I was little. So can you just move one tooth?
Yeah,
can you just fix the lower? Can you just fix the upper?
Yeah. So, sometimes the answer is yes. But a lot of times the upper teeth and lower teeth, there's not an interface, but they work together in that sometimes if it's an upper tooth that's just sticking out a little bit, there's a reason it's sticking out. It's because the lower tooth is pushing on it. So sometimes you need to move that lower tooth back out of the way, and then you can get the upper tooth in the right position. And stability for that's also important too. If you put a tooth in a position where it's constantly hitting or banging against the tooth on the other side, we say the other arch, or like the lower teeth are banging against the upper teeth, that tooth's going to want to move right back into position the second you take a retainer out. So just because you can move one tooth into one spot, if it's just that's what's bothering a patient, doesn't mean that it's a good position to put it in or that it's going to stay if you don't address some of the other issues and other teeth around there. But sometimes, yes, you can just move that one tooth, but a lot of times you may need to look at the kind of other teeth to see if it's best to put that in a position that is stable and going to last long term.
Okay, so that kind of leads into another question, is that a lot of our adult patients are like, I had orthodontic treatment in middle school, in high school, and I've had some shifting. Why does that happen?
So there's just, every time that you bite down, there's a little bit of force that allows the teeth, that basically slowly pushes the teeth forward. So as you age, teeth are always going to want to drift forward unless you're wearing retainers. The only way to keep teeth from shifting is wearing retainers some nights a week. Kind of the old school thought used to be that wisdom teeth are what push those teeth forward, but there's different studies and different things that you look at that there's constant force moving those teeth forward with or without wisdom teeth. So
I had all my wisdom teeth removed, and my teeth shifted in my mid 30s. So
So the only way to keep teeth straight is wearing retainers. But teeth will continue to shift, and some patients that we see, their teeth shift a lot, and others just a little bit. There's no way to really know how much movement or shifting will happen over a year period or even a 10-year period. And that's something we guess all the time. And the answer is we don't know. You can monitor and see how much things will change if you're not wearing retainers, but there's no kind of crystal ball that'll tell you that.
Okay. And some people just have great teeth. They just are born with great teeth, and they never need to come and have treatment, and we're all jealous of them. But for the rest of us.
A lot of times teeth will move.
Okay. So we have come in for the new patient exam. We have met our wonderful treatment coordinators who review dental and medical history. We've done all of the records. Dr. Alex or his brother, Dr. Zach, have examined your teeth and your smile. And then what's next? I know so people wonder what happens after that.
So we will review kind of all your treatment options. So we'll go over and we'll look at that 3D scan that we talked about. We'll look at your x-rays, we'll look at your photos, and come up with a comprehensive treatment plan. Sometimes there's options, whether it be If we're addressing some teeth, sometimes occasionally, treatment might involve having some adult teeth out. We'll talk about pros and cons of all of those options and kind of let you make that choice. Our treatment coordinator will review the financial options with you. And then from there, depending on what treatment course is best or what option you choose, whether it be kind of traditional braces or Invisalign, if we're talking about full treatment or comprehensive treatment, as we call it, then typically it's about 3 to 4 weeks until the Invisalign treatment will start, or the next time that we would see you, braces would go on.
Okay, so I don't need to come back to review finances. You do that in the first
Correct.
visit.
Yep.
And then I don't need to come back again before I actually get my Invisalign or my braces?
Nope. So all of the way that we have our consultation set up, and the reason that you spend that hour with us is so that we have all the information, so we can let you know what the treatment options are that day. And you'll have a very clear understanding what the financial investment or commitment would be. And then from there, just let us know when you're ready to start. So it is just that one visit, and then you have kind of a clear picture moving forward from there whenever you'd like to start.
And that first visit is complimentary for 90% of the people who come to see us.
Yep.
So we don't charge for that visit, which is wonderful. You get to spend an hour with our team. A lot of time you get to meet many members of the team in and out, just saying hi or as you walk through the clinic. So that's fun too. Do you want to talk about the clinic and what you can expect as you walk through our office?
So we have an open clinic design. So it allows our team members to kind of communicate freely throughout the day, as well as kind of the doctor, myself, knowing kind of what's going on from that standpoint. Typically, a traditional visit is anywhere from like 10 to 30 minutes, depending on what we're trying to accomplish. So we know that your time is important, and everybody's busy these days. So we try to make it as efficient as we can, so that you're not coming and waiting a long time, and then waiting a long time for me to see you. So that kind of open floor plan and open design allows us to kind of move quickly throughout the day and kind of address what we need to see you for, and then you can get on with your day. And then typical visit in between those times is anywhere typically from like 2 to 3 months if you're in braces treatment. And if you're doing clear aligners or Invisalign, sometimes it's anywhere from like 4 to 6 to 8 months, depending if we're using a kind of a component with dental monitoring that we'll probably cover another time.
Dr. Alex was talking about how in our office, your time is very valuable to us and to you. And he mentioned, we don't want to keep you waiting. Honestly, if someone's waiting like 5 minutes, we are stressed out, and we never want anyone to wait even
Correct.
5 minutes. We think that is not great for anybody. So know that we are striving every moment of every day to run on time. That being said, if you are someone who isn't local, or maybe you're super, super busy and you really want to get in for a consultation, but you only have 20 minutes on your lunch break, what options do people have?
So we offer a virtual exam or consult for patients. Typically that would involve you taking some pictures of your teeth, and then you'd send those to us, we review them, and then have a kind of a live video or Zoom with you to kind of discuss everything, listen to any concerns that you have, kind of talk through what your goals are of treatment. And then also typically, as long as we can review everything picture-wise and be clear, go over kind of what treatment options there are, as well as the financial investment as well. So that allows you to have an idea, if you're not able to come into the office, kind of what our treatment option would be. And that's all predicated on kind of seeing you in the office after that time and reviewing x-rays or radiographs, and just seeing you to make sure that there's nothing that we couldn't see on the photos. But that gives you a really, if those that may not be able to come in, or time is tough to come into the office, it gives you an idea of what your treatment options would be and the length of time and the cost from that standpoint. And that's really a benefit for somebody that may be traveling a little ways to see us. And it's something that patients take advantage of often.
So just from the photos, you can determine their treatment plan?
A lot of times, yes.
Do you have a ballpark of how accurate?
Yeah.
What percentage would you say you've?
Yeah, probably at least 80 or 90% of the time, our treatment plan is the same. Occasionally, if there's something with a back molar or a back tooth that we can't quite see, and then something looks a little different on an x-ray, but at least 80+% of the time, what we kind of present that time. And even if there is a change, it's typically going to be minor. Being able to see where your bite is, how those teeth align, and how things come together, we can make a pretty quick and accurate kind of treatment plan for you based on those photos.
Okay, and we don't just treat patients here in Fairlawn and Medina. We treat patients kind of everywhere, but where are some of our, I guess, most remote patients located?
Yeah, I think currently we've treated a number of patients that may be in college or are here just for work or a few months. We've got patients that we see in Texas, California, some in Florida. So it's not uncommon for us to see patients that may come in for treatment, come in for that initial exam. We get all the records that we need, and then we try to keep the visits to as few as possible. But a lot of times, especially with virtual appointments and Invisalign treatment, we can see it just a few times and then finish a treatment that may take a year or two based on those few appointments.
Yeah. We talked mostly about the new patient exam and what to expect for your first visit here. But honestly, we didn't even get into treatment, like what treatment entails. So I guess we'll wrap for today, and then we'll be back to talk more about what Invisalign feels like, what braces feels like, what your appointments look like, and all of the stuff that happens after you have your Mellion smile, right?
Great. Yeah. Thanks for spending time with us. If you have any questions, feel free to put them in the comments. Thank you.
Thanks.